Welcome back to Sports Medicine Tips, sponsored by Associates in Orthopedics and Sports Medicine. And we've got Dr. John Norman with us. Dr. Norman, welcome to the show.
Thank you for having me again.
All right. We've got a great topic, I think, ankle injuries. Lots of folks get them every day and just very common injury. Talk a little bit about that and what you guys see as it relates to sports.
Well, you know, one of the most common things that we see on the sidelines on Friday nights at the basketball games and pretty much in any sport is ankle injuries. You know, ankle injuries are very common. They're difficult to prevent, and sometimes they can be rather debilitating. They can really occur in any sport, can occur in normal day-to-day life, so they're not only sport-specific, but again, they're very common, and it's one of the things that we are asked to evaluate on a regular basis.
So how do you know when somebody sprains their ankle, what's the first thing that they should do when they've done that?
Right. Well, I mean, you know, we usually evaluate the ankle and try to figure out exactly which way the ankle turned. You know, did somebody step on the ankle? Did the ankle get hit by a ball? You know, the initial treatment would be an assessment to make sure things clinically are aligned. You know, the old Rice technique of rest, ice, compression, and elevation. Whether or not someone can bear weight on their ankle, you know, helps us to assess whether or not we really think they're having, you know, more of a sprain or a fracture.
Mm-hmm. Now, how about, let's talk a little bit about prevention of these injuries. Let's back up a step here. What about ankle taping or ankle braces? I know there's been a lot of stuff going back and forth about that. Talk about that a little bit.
Right. Well, you know, most people initially felt that taping was preventative, and they never really proved it. You know, now we do think that there is some benefit to either taping in people that have never really had an ankle injury. And there's definitely been some recent studies that show that some bracing with what's called ASOs, which stands for ankle stabilizing orthosis, which is basically a combination of lace-up and Velcro brace, may be preventative. Other things such as, you know, good strength, doing some exercises that sort of give the ankle better feel when it gets in unfamiliar positions, those tend to also be preventative.
Now those braces, I think, are the ASOs that you're talking about are really good, especially at the high school level and middle school level where they don't have the resources of all the trainers and all the tape. It's really a good way to get some support without having to do the taping.
Right. You know, with those braces, the kids can put their own brace on, and you know, really, you know, I actually think the braces probably work as well as taping in prevention, and also in people that have had injuries. You know, we tend to ask them to wear those for 6 weeks at least after injury, and you know, most of the players will end up wearing them routinely for all their sporting activities.
Now talk a little bit. Sometimes you'll see on a football game a guy will have an ankle injury, and they'll come and they'll tape over the outside of the shoe. Talk a little bit about that and what's going on, you know, with that type of.
I think in a situation like that, they made an assessment that they probably don't have a fracture, and I think they're just trying to add any stability, you know, in the moment. I think that may be an in-the-moment kind of treatment to try to get somebody back into a game.
Well, let's go back now. If you do have an ankle injury and you come and get evaluated, what's the course of treatment for say, a severe sprain? Then I also want to ask you about high ankle sprains, too, and talk a little bit about the difference in a regular ankle sprain and a high ankle sprain.
Well, you know, typically for ankle sprains, you know, we try to grade them based on, you know, whether we think the ligament's just stretched or disrupted completely. And, you know, most of the time the treatment, again, initially is some rest and compression and ice. Most of the time after that, we use physical therapists to help us to strengthen the ankle, to work on range of motion of the ankle, and to also do some what's called proprioception type exercises where the ankle sort of has kind of the internal brain of the ankle, the feel part of the ankle that we have a hard time anatomically describing. And again, we usually do use bracing for several weeks after we allow somebody to return to play.
All right. Well, thank you very much for coming on and talking about ankle sprains. I know it's a big topic and a lot of interest to everybody.
Thanks again.
All right. Stay tuned. We'll be right back.